All right, so I was talking about Lombard effect. So that is a reflex that is a tendency that we have to speak over background noise, with a restaurant being a really good example of that. Now, of course, the difference in a restaurant is that noise stays on. And that is not the case with the Speech Vive. The Speech Vive takes advantage of that reflex, that Lombard effect, and it delivers that babble noise, that noise that you hear in one ear. And it just serves as a cue. It triggers you to speak over that background noise. So when you were in therapy, and I think almost everybody I've met prior to getting their Speech Vive probably did speech therapy, your therapist was cueing you, and that cue might have been to speak loud, to speak with intent. Those are all ways to help you be louder. But for many people, when they leave the therapy room, they're not able to self-cue. And so the Speech Vive serves as a continual cue to help you stay louder. So once the device is programmed, it's voice activated. And the babble noise or the multi-talker noise is just playing in one ear. So again, unlike the Lombard effect in a restaurant, it's not staying on all the time, so it's not interfering with listening or hearing, and it turns off when you're not speaking. It also tracks speaking time and intensity. So that's important for us as programmers if somebody need to see them again. And it's also important or helpful for your therapist to see what progress you're making by using the device. When the device is programmed, it is designed to give you about a 3 to 4 decibel increase in loudness. So how do you wear it? When you ordered the device, it was for a right ear or a left ear. They are not interchangeable. I had a call from someone who said that the device wasn't fitting, but in fact, he was putting it in the wrong ear. Your device came packaged with 3 ear tips, a small, medium, and large. And I can't tell just by looking at someone what the best size is. I'll usually start with a medium. But if you find that the ear tip is not seated well, you might want to change that ear tip to a different size. It doesn't go deep into your ear canal like a hearing aid would, but it does. You do want to have it seated in your ear because it needs to pick up the vibration. And if you lose or would like to just have an extra ear tip, you can order those on Amazon. They're pretty inexpensive, about $8. So I would say this is one of the most common comments I will get from somebody after their device has been programmed. And that is something about the babble. The noise isn't coming on. The noise is on all the time. It's making noise. I don't hear the noise. And so the first thing I always say is you're paying attention to the wrong thing. Yes, you're going to notice that babble noise, particularly the first week, maybe 2 weeks that you're using the device. I notice it when I put it in my ear. But if you are paying attention to it, you are paying attention to the wrong thing. The babble is going to come on when you begin to speak, and that's because the device is working the way it should. Your job is just to talk, to just communicate. If you hold your finger on that ear tip, the babble is going to stay on all the time, so you don't want to do that. How often should you wear it? So one of the things that I know we as the programmers always go over when we do that original programming is that the Speech Vive is not a passive device. And you're going to get the training benefit every time you speak. So ideally, you should be wearing the device about 4 hours a day. And in that time frame, you can wear it more, but during the time when you're wearing the Speech Vive, you need to be speaking. And so in the original research, participants were asked to use their voice 20 to 30 minutes a day outside of whatever conversation you're engaged in. And give you a few suggestions of how you can do that, but that's really key to the success. And just to illustrate that, I want you to look at these two graphs up at the top. So this was a patient who recently I programmed her device. About 2 weeks later, she reached out to me and she said, I don't think it's working. I'm not being loud enough. Now, first of all, probably you're not going to be the best judge of that change in your loudness, but your family members most likely will be. But look at the graph here. So this was the day I programmed it. And over that 2-week period, on the side here are the times, she wasn't even using her device or speaking 10 minutes a day. That's not enough speaking to get the full benefit of using the device. It is not a passive device. But if you look at this graph over here, this was a gentleman who reached out to me. He'd been wearing the device for about 3 months, and he said, I think maybe the settings need to be changed or modified. So we met, and the first thing I always do is look at the device usage over that period of time. Look at his device use over a 3-month period of time from November till the beginning of January. He was averaging about 35 minutes a day of speaking while wearing the Speech Vive. A few days he was peaking at 40 minutes. That's great. And interestingly, I actually reduced some of the original settings. So that was evidence that, in fact, his voice was getting stronger just by use. And that's what the effect is, the retraining effect. So what are some things you can do? You can read out loud, read the newspaper, read emails, text messages, make a phone call, say your prayers, complete speech practice from other therapy that you've participated in. You probably have all kinds of home practice. The important thing is to be using your voice. So on the right side of the screen is a patient of mine, Barb. I met her back in 2016 when she participated in some research that I also participated in. And at that time, I was meeting with patients via telehealth to remotely program their device. And then every 5 weeks, over a 90-day period, we collected acoustic data, voice data. She was great during the research component. Every time I met her, she was speaking better, louder. She was telling me that people were commenting on that. So she has been wearing a device since 2016. This year, around December, her husband reached out to me a little bit panicked because her device had accidentally gone in the wash. She came down to my office after she got her replacement device for me to reprogram it. But because I had met her in 2016, I had all of the measurements from that time, including all of the measurements of her voice doing a variety of speech tests. And interestingly, her acoustic data, the measurements, were within 1 decibel of where they had been 8 years prior. So it was a great example of someone who really continued to get the benefit from speaking and wearing the device. And even though her motor symptoms from Parkinson's had showed change over that 8-year period of time, her speech was nearly unchanged. So every time you speak while wearing the Speech Vive is when you're getting a retraining effect, meaning you are using your muscles differently. The device is just the cue. You're being louder because you're using your voice mechanism differently. So even though the Lombard effect is instant, we notice that at the day we do the programming, the retraining of the muscles, the benefit is going to come in all of the next following weeks of voice use. And in the original research, they found that after that 8-week period of following patients, 90% of them had improved their loudness by the end of that 8 weeks of treatment. So how do you care for your device when you're not wearing it? Put it in the charger. And then I know at the end of my programming visits, I always say, just like your cell phone, it doesn't like water. Don't drop it in the toilet. Don't wear it in the shower. Don't wear it in a swimming pool. And those are all things that have happened with people I knew. So important to take care of it and put it in the charger when you're not using it. And I know that insurance came packaged with your devices. If you have not yet taken out that insurance, I would really encourage you to do that. If you have questions about it, you can reach out to Michelle at the company and she will help you with that. But I do know that if you have the insurance and something happens to your device, it will be replaced. All right, so that is the end of my little component. I am going to